Welcome to About the House. With COVID-19 being a part of our lives for over 2 years now, and the emergence of long COVID and repeated infections, the House of Representatives Health Committee has begun an inquiry to look into the long-term effects on Australians. We caught up with the committee to find out more about the inquiry.
We have been inundated with concerns about COVID and long COVID and recurrent COVID and how the health system is dealing with that. Issues with things around the management of people who have ongoing symptoms from COVID infection, number of people who are being hospitalised with chronic conditions due to COVID, such as chronic lung conditions or cardiovascular symptoms and stroke and a whole range of illnesses. And there's very little information out there about the exact nature of this and the treatment and long-term prognosis. And so we were really keen to gather what evidence we could, in the knowledge that there have been lots of anecdotal reports but very little hard data collected about this.
We're hearing so much anecdotal reporting when it comes to long COVID, and I myself experienced some form of long COVID after contracting COVID and still have the effects today, many months after COVID, as do many other Australians. So we want to collect the evidence, speak to people who have experienced long COVID, and also to speak to their families, to speak to researchers and to organisations, even mental health organisations.
As well as the devastating health effects, the committee is looking into the many other impacts COVID-19 is having.
So long COVID is unfortunately affecting people in the prime of their lives. And as a result, it's causing immense disruption, not only to them and their health, but to the wider economy, because it's effectively taking people out of circulation and out of work. So it is imperative that we now do everything we can to put downward pressure on these infections and to also help these people with long COVID so that they themselves can return to productive life. In doing so, support them and their families.
The committee wants to hear from a wide range of people, from everyday Australians to experts.
We really want to hear from all sides, patients, clinicians and medical researchers. And I guess as well epidemiologists and economists as well, potentially, about their concerns about how this will affect us all long term. People who have been affected by long COVID, we want to hear about the physicians who've worked in this area. You know, a lot of people's lives have been turned around by this condition in the last couple of years. A lot of medical professionals have, had to turn and concentrate on this one area for a prolonged period of time. And I think we really respect the science that they can bring to this.
I know that this syndrome is disproportionately affecting women. It's also disproportionately affecting young people. Now, young people and women are amongst the busiest people in our community. They're just working, or they're studying, or they've got care responsibilities. So for many of them, this is not a priority. But I would strongly urge them to reach out to us and send a submission in, because that's how we're going to be able to act and do something about this.
Individual patients who've had long COVID or had experience caring for someone with long COVID, we're interested to hear the experience of other institutions, businesses, schools, universities dealing with this ongoing pandemic, and in particular people who have chronic symptoms.
Thanks for watching. To find out more about the inquiry, or to put in a submission, visit aph.gov.au/long and repeated COVID.